Hello everyone, we are from IR Technologies Private Limited. Today we would like to share that information how the healthcare startup can grow their business. Because of in the initial stage of time, the healthcare startup has to begin with a small idea, identify the right set of audience to test the product in the market. Shockingly, what we have analyzed, nearly 75% of the MedTech startups they are particularly working in any kind of healthcare sector, they are destined to become fail. And it's not just about the Indian market, it's about that all the international market. You can go through the Google and you will see the lot of even the funded startup which is more than $1 million of funding they have raised. They make the product ready, they get the tested validation, and after that all of a sudden the startup becomes shut down. You probably know there are many healthcare startup even in India. It used to be doing a lot more better, like I think the Procto and Liberate, they are the initial stage of a startup, raised $1 million of funding, but still if you find it out the audience who is using this product and services, you will find very minimum target audience they are using right now. So what is the reason of failure? That is something very important to know. The failure, it cannot be done because of one reason, because the startup fail because of there are a number of reasons are there: the team, the funding, and the right set of audience, the marketing, excess marketing expenditure. But what we have believed, the compared to others, like healthcare sector is a very complex sector, because here the patients, doctor, hospitals, clinic, government versus private. So it's not just like the e-commerce platform or any kind of the platform, the lifestyle product. So it is something the person is already in the pain, they are looking for the solution either immediate or either in the long term, because cancer probably people are not going to diagnose in early stage, so it will require the diagnosis right now, so we can estimate the population who can get the cancer and make them provide a treatment from the very early stage. So the chances of their success rate it's become very high. So we have to identify the right set of audience to the particular location. And the people in India, they do not take their health very seriously. That is also one of the reason I think that preventive healthcare market has to be think in a very different way. So like I said, the patient, doctor, hospital, clinic, pharma, medical devices, healthcare service provider. So all these things are there, like providers, those who are providing the care at home. So healthcare need is very different as per the location. What I know about the metro cities, challenges are very much different compared to the rural and urban and suburban area. Like the patient visit to the government hospital versus the private. So like the product or services, like you are any kind of product or services you have designed, it may be very good. You have identified the problem, you have already done the service to the certain set of people to know how extent they are feeling this kind of problem, and you have built the product around this problem that anybody has given you their insights. But in healthcare, the people having their its own opinion. So if your sample size is very limited, you probably design the product according to them, not for the others' geographical location. So you have to know the depth of market, you have to know the population, and then after that, by taking that maximum of the population, what they are trying to say, what they are feeling, then you have to estimate the demand, and that you have to release the product or any kind of services. So since the healthcare information is very much complex, it's not just because of we need to see a data which is just limited to the patient. We have to see from the doctor side, then we have to see, for example, NCDs. Those who are having the diabetes, they probably get the heart attack, they probably get the kidney failure, diabetic retinopathy. So it's become even more complex while we narrow down the informations. In every geographical region, the population sets also become very limited. So we think like there is 100 million diabetic patients are there according to ICMR. But really how much people are going to use your product or services in terms of diabetic or any kind of NCD product or services that you have designed itself is a biggest question. So it's a really very time consuming process to understand and know your perfect audience. Initial stage of company, definitely they don't have a capital. It's a very small capital they have, and they have to use very wisely. They have a limited team, they have a limited resources, limited information system. And what I have find it out, the most of the startup, once they have a very limited information and they don't have the much more expertise in their team, they take a very poor decision, and this poor decision making process is the one of the reason that lead the companies toward the loss and eventually make them shut down. So you have to take the decision by taking the lot of informations. Then you have will going to precise your product or services to set of target audience. Once you have a limited capital, you cannot utilize in a very unlimited manner toward the marketing and the sales. Before that, you have to validate the. So the poor decision making process, what it lead to uncontrolled marketing expenditures, because you will do the lot of Instagram, Facebook or Google marketing. Then after that it will lead to lot of expenditure in your bank account. And then after that you will be feeling like my customers are not coming and I'm making the loss. The product unable to reach the right set of audience. That is the reason. Even if you have done the marketing, but it is not catching the right set of audience because they are sitting somewhere else. Hiring the sales team before validating the product. So this is something which is very much dangerous. Like you have hired the excess amount of team member without knowing whether your product fit to the market or not. This is the poor strategies to enter into the market. So you have to be very careful in this particular detail. So how we can help as an organization which is working in a healthcare domain since last 7 to 8 years. The team members having the more than 10 to 23 years of healthcare experience, they can help you to identify the geographical strategies to enter into the market. We will become more precise. The chances of taking wrong decisions we will try to eliminate based out of data driven model. Identifying the right set of audience for your product and services. Control the marketing expenditure so you will be save your capital for the future hidden trial model use. So improve the product designing as per as understanding the customer market need or what the need of the market in coming days, in the coming like future. So these are all the value addition we can help you in. So basically this is the IR healthcare data solution. We have scrutinized all the 28 states of healthcare data, 400 cities, their population. We have done studies, the lot of research paper. We have done studies about their what kind of healthcare challenges, problem they are feeling. The government institution, we have done the collaboration and studied about their journals. So institutional like hospitals or any individual patient. So this all about the unstructured data we have converted into the information and the meaningful insights. So any of the healthcare company can take a better decision. So the pharma company, if they wanted to know where is my product can be sell as a diabetic, I am making the medicine which can be reduce the obesity as well. So I can help you to find it out where the population sitting having the both diabetes and the obesity both. The same ways where the population is sitting, those are having the diabetes and hypertension. So we will do the lot of probability test where it can be having the high probability of getting any number of patients, where the doctor and the patients taking how they are taking decisions based out of their behavior and their psychographic analysis. So this is something is very important that we are giving to you as a solution. So you will having the edge with an access to deep market insights. It can help you to reduce a lot of time to analyze the data, improve the decision making process, as well as the lot of effort that you are making to understand the market. It can be also saved. So in a one word, it can save a lot of time, effort and money. You will take and design the better product for the market. So the market need, market research, discovery, product designing or anything that you wanted to do, it can be very helpful. So you can see the screen here. We have mapped that Indian demographic as per as where the population are visiting the government hospital or the private hospital, old age population, how much they are likely to visit where. So this is something that you will come to know and you will understand where my product. The same thing we have done for the combination of diseases. So this is something that can help you to understand where my product. So you can book a demo and you can book an appointment with us, book a demo and call us, and you can make us understand what kind of healthcare domain you are. We will definitely try to help you to improve the market. Feel free to connect with us. Thank you so much for listening to me.